Hi everyone, it's Emily Bach here. I'm going to be presenting on abnormal uterine bleeding. History of present illness. Adeline is a 42-year-old female G2P2 with 2 living children, presents with painful and heavy menstrual bleeding and bleeding between her periods for the past 3 months. Complaint. Adeline's chief complaint is abnormal uterine bleeding. Subjective data. Adeline should be asked about the possibility of pregnancy, her menstrual history and bleeding pattern history, including if her bleeding is related to any activities, her sexual history, including any risk for STIs, any OBGYN-related surgeries, her contraception history, does she have any risk factors for endometrial cancer, her past medical history, is she having any symptoms related to anemia, bleeding disorders, abdominal symptoms, urinary symptoms, or any signs or symptoms related to an endocrine disorder? Is she currently taking any medications? If so, what are they? And does she have any significant family medical history? Objective data. Vital signs should be obtained first, including a blood pressure and heart rate. The height and weight should also be obtained to calculate a BMI. The following assessment should include a skin assessment, a neck assessment for the thyroid, a breast exam, an abdominal exam, and most importantly, the pelvic exam. The pelvic exam should include a speculum and bimanual exam. It's important to note the site of bleeding, the volume of blood, any clots or passage of tissue, and the appearance of the cervix. On the bimanual exam, the size, contour, and tenderness of the uterus and ovaries should be noted. For labs, a serum or urine pregnancy test should be obtained, a CBC with platelet count, and then a thyroid function test, which is typically just the TSH. Assessment. Adeline is diagnosed with menorrhagia or dysfunctional uterine bleeding. Plan. First, the patient should be sent for a transvaginal ultrasound to get a better idea of what's going on. Depending on what the ultrasound shows, she may need a hysteroscopy or a saline-infused sonography. The first line of treatment for abnormal uterine bleeding is hormonal therapy. The only FDA-approved oral contraceptive for heavy menstrual bleeding is Nadazia. She should also take 500 milligrams of naproxen for her dysmenorrhea and heavy menstrual bleeding. So it should be 500 milligrams of naproxen PO initially, and then she should go down to 250 milligrams every 6 to 8 hours for pain management. She should also be educated on menorrhagia, a normal menstrual cycle versus what she is experiencing, potential causes of that, diagnostic tests used to help diagnose, the various treatment options that there are. She may potentially need a referral to GYN if she is unresponsive to medical treatment or needs further testing that the provider is not comfortable doing, or if she is severely anemic. The patient should follow up in about a week to make sure that her bleeding has stopped, and then she should follow up around Q3 to 6 months. Here are my references. Thank you for watching my presentation. Bye.